Look at those piano legs.
Check out those PVC pipes.
Are your cankles making your legs look like tree trunks?
So we're talking about the dreaded cankle. That's, of course, a shapeless ankle. And we actually have Audrey, an audience member, here. She's going to help us out because we have a few things that may be a cause of cankles up here. Now, there's also a couple things up here that may help your ankles have a little more shape. But I'm going to ask you to pick out some things that could be the culprit for the dreaded cankles.
Okay, all right. Well, my first product I would pick is probably the soda because it's loaded with sodium, which causes fluid retention.
Dr. Warden?
And that is a good choice.
Okay.
That's very, very true. Retaining fluid, which is associated with salt, you will do it in your ankles. So that definitely can contribute to those cankles.
Okay. My second would probably be traveling by airplane.
Building model airplanes?
Not building one, no.
Have you ever gotten off a long flight and noticed you have some swelling in your legs?
Yes.
That's pooling of the blood in your veins of your legs. Very common. And one of the things you're going to want to do is get out of your chair regularly, go for walks, because those muscles of your leg, you want those to engage, because as those muscles of your leg engage, they actually will push that blood back up to your heart so there's not as much edema, quote-unquote, swelling in your legs.
Okay.
You can wear certain socks, etc.
That may help. Even just flexing your calves, if you're not getting up, that helps. And the same thing, avoid the salt when you're on the airplane.
Okay.
The two go hand in hand.
All right, so one more.
One more. I'll just say the water maybe, if it's too much water, if you're not.
You want to stay hydrated.
Oh, okay.
Staying hydrated is very important for your health. But where I do want to hit on a couple quick things. We have these kidneys up here for a reason. If you have kidney problems and your kidneys aren't appropriately filtering your blood, or if you have heart failure, you can actually get pooling and swelling of your legs, as well as fluid in your lungs and things of that nature. So if you have chronic cankles, and especially, and this also goes for certain other illnesses, if you notice that you can press and indent the skin, and when you let go, there's big finger marks, that's from fluid. That's not just the dreaded quote-unquote cankles from an ill-defined calf muscle or an ill-defined ankle. That could be from fluid overload.
And that leads into, I treat cankles with liposuction, with surgery. If we've examined somebody very, 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 very carefully and determined that it's fat and not fluid retention, we go in, tiny little incisions on either side of the ankles. Obviously, we go in with our blunt liposuction instrument, remove that fat to create nice shape and transition from that calf to the ankle, and it works.
And with liposuction, jump roping, working on those calf muscles, nice little definition there, a little more accentuation of those curves.
Exactly.
Thank you so much, Audrey. You did a
Thank
wonderful
you.
job.
Thank you.